From one ER about the other. Listen up, you're at an ira time in your life. Right now, you listen to Avril. Let the truth be known.
In the politics area, you know, she have it.
Never had a boring moment in my life.
She's the voice of the Caribbean.
Back as I remember, I was never alone. Queen Avril is on the throne. No more feeling lonely. Avril rules the air, you know. Every day is like an Avril day.
What is this for me? Huh. Okay, we are going into this right now. It's the Avril Show. Welcome, welcome, welcome. If you're out there, feel free to comment. Feel free to comment. And let me know that you're out there. And let me know how beautiful I look. And don't be afraid to, boost up my head and tell me how beautiful I look tonight. It's not necessary for you to afraid to make a sister feel special, even though I feel special already without you doing it. But anyway, the Avril Show is here. Get ready because we're going to be talking tonight. And I know sometimes people are just waiting or they just log on to see what I'm wearing. If I learn how to put on my eyelash right or all these stuff, but it's getting there. It's getting there. One day somebody will reach out to me and assist me. So get ready for the show because I'm coming up to talk about some things, issues, concerns, and we are going into it tonight. We have to talk about it. Oh, that's so wonderful. Someone on YouTube says, I look beautiful. So if someone on YouTube, Valencia, say, I look nice, I look spliffy. You understand what I'm saying? We're here tonight to talk, and we're going to be talking about the real issues, the real things, exactly what I said. So get ready because I'm coming. I'm coming to you. And sometimes people come on and they just don't know how to say, Avril, you look so beautiful, and boost up my head for a minute. They just come on and they just probably come on to see if, I'm learning how to put on my eyelash and my makeup right, but it's going to get there on time. Don't try to make me feel bad. Join me as we dig into We the People. We're going to talk tonight. But anyway, some of you may just come on, but just to peep and jump off, and you don't have to comment, you don't have to comment. But if you come on just to see how I'm looking, like Yolanda and Orville Clark says, good evening. What's wrong with saying good evening to the sister? And you all people is something else. But anyway, we're going to talk about it tonight. I'm coming to you tonight, and we're going to talk about it tonight. And I know some people out there on social media will, get at me for what I'm going to say. I don't know why tonight just feels so different. If it's because, I just feel a little spliffy, all of a sudden, something about me just start kicking in and I can't find myself. But anyway, Avril is here. And we're going to talk about the nurses' strike. The nurses' strike. And some people may not like what I have to say. And sometimes people misunderstood or they hear what they think they hear that I'm saying. So please pay attention to what I'm saying and feel free to tell me if you disagree. Miranda, good night to you, sweetheart. I need to hire you to work behind the scene for me on this show. I need somebody to put up certain things during the show. So I have to hire you. You're my ambassador. So anyway, we're going to talk about that. Andrea Garms, a pleasant good evening to you. And I hope you're still celebrating your birthday, sweetheart. When you go through what you go through in life, let nobody tell you when to stop celebrating. Mr. Chris Graham, thank you also for commenting. And anyway, before I go into the program, I don't know how many of you saw the 24-year-old man who murdered 6 people, including a child, in a series of shootings in Northeast Mississippi. So when you're going to kill a 7-year-old and take out your family, you understand? 7. Okay? So what I'm saying to you is sometimes we don't understand. We are looking for the enemy in the people that hate us, in the people who can't stand us. But we have to understand, Celia Francis. We have to understand. Thank you so much for saying good night. Show off. Celia, girl, let me tell you something. I love people like you who don't forget. Last week, I said show off 2026 in Jesus' name, right? And you come back tonight and you remember. But anyway, let me say to you, Daniel Silvera, how are you, sweetheart? I'm just here fixing up myself and trying to look good as I speak. But as I was saying, when this young man can kill his family, take his family out, it's not the first time these things happen. But when you put a gun to a 7-year-old head and kill a 7-year-old, I want to know what is going on in the minds of our people. Well, this has to do a lot with people going to say mental illness. Please don't say mental illness because I've been mental from day one. Okay, so I please don't say mental illness because I have to speak to the DA. I look good. Thank you. Thank you, Daniel. Let me sit up a little straight. Okay, you say I look good. So I like when people boost up my head. Problem Phipps, how you doing? Good night. Anyway, so hear what I'm saying, Valencia, and my people who is on YouTube. A lot of people don't know about my YouTube page, so I don't get much support over there. But I just want you all to know that I do it on YouTube to save it because a lot of time, Facebook, after 30 days, your show is gone. It's like maybe it's too overwhelming. They can't save all the shows. But hear what I'm saying. We're going to knock mental illness. But let's look into the strike right now, right? Share the live and tell them the biggest show is on, which is the Avril show. And I want every elected officials, if they're out there watching secretly, or even Mandani, or even the mayor, or hear me say Mandani, or even the mayor, I look like a confused now. But anyway, listen to what I'm saying here, right, nurses? From what I listen to, here someone says, my hospital tried to cut corners on staffing every day. And then they tried to fight historic gains we made 3 years ago, okay? A pediatric intensive care nurse in New York Presbyterian Hospital says that. The hospital, meanwhile, have called the union strike threat, reckless. They vow in a statement, right? So Joycelyn Bramble, good evening to you also. What they are saying, okay, is that the nurses, Why Young, are coming to you. Thank you so much for tuning in and for sharing my show. Even before I started, I saw that. Thank you. You have always been someone who has my corner. Now, the nurses, back in 2023, the labor fight, despite the pandemic. Oh, I prefer YouTube. How to find it? I want to watch you on your 80-inch TV to see if you look good for true. Love and Bob, you is my family, and you're one of them that I have to just make sure I look good for. Love and Bob, on YouTube is the Avril Show. It's the Avril Show all over. Okay, so let me know if you find it, okay? So anyway, yes, but people are watching it on YouTube, so if they can comment here and let you know how they find it, it is the Avril Show on YouTube. If 2023, they got raised and they went through all that they went through, I'm concerned about we're in 2025. So they says that they are fighting for safer environment, right? The strike impacts operation at several of the city major private hospitals, right? We all know that. Nearly 15,000 nurses walk off the job early Monday with no deal reached. Okay, they've been sitting at the table, and someone said today, oh, they needed to sit down. They've been sitting at the table. They've been going over. They just ain't come to a deal, right? So if the strike is impacting operations, why is it that I ain't gonna call your name? She said, Avril, do not call my name on your show. And when people talk like that, it's like a threat. I have to say, okay, I ain't calling your name. But she said, the floor licked me bad. I'm sick. I am sick. But I don't want to go into Montefiore because they're gonna know I work there. And the fact that we're striking. So the nurses say the big budget medical centers are refusing to commit to or even backsliding on previous for managerial sake. And they're saying they're not getting what they want. So my question as a people, right? Let me ask you guys how you feel out there. You're going to sit here and tell me we're going through the worst, we're still going through this pandemic they call the flu pandemic, right? Now, this young lady who is a nurse that says to me, Avril, do not call my name on your show. I'm not going to call your name, but I'm going to say it as a way to say how God sometimes do things in his way and we don't recognize it. She said, I am so sick but ashamed to go into the hospital I work because we're on strike. I say, even if you go, you're going to get the care that you need, because they have to take care of you. But imagine you're supposed to be there taking care of us, and you're going to strike at a time. She said, first of all, I don't care for the strike. It's not about me striking. It's the New York, okay, New York Nurses Association, NYSNA. So I wonder who that organization belonged to. Okay, the New York Presbyterian goal is to reach a fair and reasonable agreement with NYSNA union leadership that reflect our respect for the critical role our nurses play. Montefiore, the lady says to me that Montefiore is trying to capitalize. They're working their behind off, and Monty's saying they can't give them the raise that they need when our hospitals are in crisis right now. Everything is a cutback. You could imagine that so many people are being laid off that many people are not aware of because of the cutbacks in the hospital. Happy New Year to you, to Janet. I chat about you last week, but you wasn't listening. But me and Celia Francis, we chat you off about our days back in our school days. I'm coming to that. So Janet, in the health field, all of us in the health field, right? Now we know that we're supposed to be paid our fair share and we work hard and we're supposed to do what we have to do. But I want to know, with everything that's going on with this administration right now, since I don't want to call no name, right? Happy New Year to you also, Rosia. Marissa, I haven't seen you in years, but Happy New Year to you. Maybe one day you could fix up my hair and make me look a little better. But anyway, you trying to tell me all the cuts that we have going on in the healthcare system, we have shortage of doctors, we have shortage of this and that. There's so many cutback. Healthcare is going to the dogs, okay? Healthcare is going to the dogs, and I'm going to say that, okay? And we are sitting down here saying the nurse is right. The nurse is right to strike because they need more money. While the hospital full of patients sitting up there, some of them belong to us. Some of them belong to the nurses, them that striking. And people going to think I'm against the nurses. I'm not against it. I'm just wondering if it's a setup with the union, and who owns this union, that at January start, they're ready to say, go on strike. I think we are set up in many ways, for failure, because a lot of cutbacks are coming. A lot of cutbacks are coming. And a lot of people are going to be faced with layoffs soon and very soon because some of these hospitals is in crisis financially. Do you know when they cut Medicaid and they cut this, a lot of people I don't understand what Medicaid is. People, there was a time I thought when they say Medicaid, it's for the people and where don't have money, don't have good health insurance, and all their Medicaid people that have nothing to do with me, right? Julie B, good evening to you all the way from the Virgin Islands. I have some Virgin Islands people, Janet Richardson and Celia Francis on the link too, right? But hear what I'm saying to you, right? If you pay attention to no matter where you live, the hospitals, we are crying out for better health care. Now, one of the nurses say that, I'm going to pull up what she says to me here, is that Governor Herschel expressed concern that a strike could affect patient care. Okay? The governor urging both sides on Friday to stay at the table and get a deal done because the strike can hurt patient care. They still strike. So people want their money. It's like they're saying, we don't care, we want our money. I don't believe this nurse that told me. She just become a nurse. Don't even know how to do nursing. Sweetheart, if you want to cuss me, go ahead. She don't even know how to do nursing yet, because some of you think because you go to school and graduate and come out and have an RN degree in school paper, and you all ain't even gone on the job yet to know if you all could understand what it is to see blood and brain pop out and all these things where officers go through and firemen go through, and you all have not experienced what it is to work on a floor where it's real emergency. You all are not nurses yet, you know. Because going to school, nobody cheat more than me. I used to cheat off a Laurie Sergeant paper. Me sit behind her every day. Because the minute the teacher give us a test, I sit behind her and I say, hold up your paper a little higher. So when she hold it up and she put A, me put A too. And she had B, I put B too, because she was very smart. And me know if she pass, I'm going to pass. But I used to make sure that I don't get everything like Kaka. He gonna know that I'm cheating. You cheat your way to school half of the time, and half of it is not professional enough to do the work. Well, let me tell you all nurses something. I've been in the medical field since 1983. I know what it is to be on the floor doing patient care, taking care of my patient, loving on my patient, making sure. Some of you nurses, me only have 2 hands. Y'all not gonna stress me out. Me have enough problem home. Me hear some behaviors on the floor. You walk in the hospital and the clinic, them, some of the way them talk, they don't even understand what it means that when a patient is around, how to hold them out, how to know what to say. Sometimes them argue because, me here, you know much this, they not pay me enough. But meanwhile, they're saying that, they might cuss over you, you know, who is a patient. And half of them don't have no discipline when it comes to what real patient care is all about. The patient, them, they drag them. Some of them, you're ringing the bell and they're sitting out by the desk, and all them do is chat day and night. Some people say, me work at night because the work is less. They just want to make the money, but they don't want to do no work. When a patient is admitted, sometimes it's hell to get the patient to the floor, because some of them extremely rude. They're not talking about that. The first thing they tell you, me rude, but me I do the work, sweetheart. I know the nurses, and Cheryl Bonnet Walker, good evening to you, nurse. Correct me. Because I am not knocking nurses, you know, because I'm in the field of medicine since 1983. I know what it is to work in nursing homes, and we are short of staff, and I have 14 patients to finish up in the 8-hour shift. I'm there, bathing them, taking care of them. Sometimes I'm late because me want to make sure my patient powder up and feel good. Sometimes I chat me to death. I can't leave, but I is somebody mother, and I say, Lord, they don't have the family around, the poor lady. I may sit there with them, I chat till me reach home late. But when I reach home, I feel so good in my spirit. Nowadays, nurses don't have no time for all that. They will look at the patient and say, a 14 patient me have no, and every minute you ring off the bell. And I am telling you, nursing assistant is on the job today. They can't strike. They're not striking because different unions. But I will sit here to say, anybody will feel like because they're nursing assistant that you're not important, I'm here to tell you, you are very important. Because without you, the nurses can't do it either. Without you, the doctors can't do it either. Nursing assistant, you carry the bulk of it. Some nurses will push the cart and give you 2 Tylenol. And they will see the patient dirty. I was the only black. I read your stuff. I was supposed to get in touch with you. We're going to talk. But thanks for posting it. Let me tell you something. When you do 24 years, they don't want you after that. They want to bring in the person who could do the cheaper work, the cheaper labor. Me know how these things go, you know. That's why me say, when you reach a certain age and you could do retirement, cut down. Me not say stop work, you know. I say cut down. It don't make sense. You bend your back over and you can't do it. Let the young people them get a chance. Teach them, groom them to do right. Because sometimes the young people them come in to work as a nurse and they watch nurses, them who been there for years and how they do it. And they pick up the slackness and they carry on with it. Some of you all nurses just sit down upon the job and you all can't wait for the time to come to go home. The most important thing on the job now from a lot of nurses, now I could cost me, I say a lot, me no call out your name. Okay? Yes, young and skilled nurses are them in there right now. Because when you are skilled, you should be paid. They have a salary. And when I hear Montefiore would tell me the nurses has free insurance, they don't do copay, they could come there and see doctors for free and all this stuff that they get. Let me tell you something. Half of us are minimum wage workers. And I know half of us going to say we went to school to be trained as a nurse and that we study and we do this and with everything we have to study today. Nurses and assistants have to study too, but some of them is being treated poorly by the nurses too. Because they look upon them because they're nursing assistant, because they have to do, then you go in there and the first thing they send is the nursing assistant because you vomit to clean it up. Nursing assistant is even cleaning the bed, changing the sheet. Nursing assistant is asking you how you feel. Oh, can you call my nurse? Can you call my doctor? And the poor nursing assistant is have to hear that 50 times before the nurse them get up and all them are sit down is eating a bunch of cashew at the desk and they eating with their hands and them hands dirty, and me have to say, how could a nurse who dealing with patient in a medical facility sit down there and take up nuts and a chewing she mouth? Let me tell you there's something out here. You have a right to strike. I'm not saying, but you all better pay attention because I don't know. This is the largest strike in New York history. And look when it's going on. The month when every cutback is happening. They cut Medicaid. When they cut Medicaid, people, do you understand that we suffer? No matter what insurance you have, you're going to suffer. Because when they cut money in the hospital, it means that the cutback is preventing us. You don't have enough doctors. They have to do layoffs. They have to do cutbacks. They have to do all kind of things. We could hardly get appointment on time. You make appointment, it take you all 3 months. Healthcare right now, we crying out. When you strike and you go back to work, I hope you go back with a better attitude because let me tell you something. Anytime you walk into a hospital or a clinic for medical care and you all carry on with any slackness, I sit on the community advisory board at Montefiore Hospital. And if they're listening, they could tell you, I fight for healthcare. I fight for the patients. I fight for the nurses. You go to Montefiore and to 33rd, when they see me walking there, I don't ask them, how you doing? How is everything? I try to get what's going on and take it back. Because if I'm not happy with what the nurses are saying, I'm going to report it. Because I want to see the nurses, them feeling good, coming to work, looking happy, want to be there. You understand? But not because you want a little raise. You going on the job and behaving how you want, treating patient how you want, the bell them a ring all night. I am going to tell these hospital, it's time they get people to work the floors just to go around and check with the patient, how you doing, how is your day going. You need special care for patient when they're sick. Let me tell you something. I'm not going to tolerate no nurses now, you know. Since you all say you are fighting for better wage and you all better security, and one of them say what they want is this and what they want is that, well, we the patients demand better. And we the patients demand respect. And we the patient demand health care, better health care. Okay? So if you want more money, we want better health care. We don't want you to sit down at the desk all night, and we want a little water because we walk dry and people can't walk, and the poor patient laying down next to me when I was there in November can't get up. Me have to get up every minute because I had to look out for my neighbor, which was the patient next to me. And when we go down there, the nurses, they must sit down. Oh, I come in, man, I come in. But because they see me now, they get up. It's time to, if you're going to work for it and you're going to fight for it and you're going to get it, let me see better health care. Let me see better health care. Is we patients supposed to be striking? Nurses, you're getting paid. You got medical, you got everything that you need. Sit down at the table, make a deal. But let me tell you something. When you get the money and the hospital are short and they have to start to lay off, and they have to start to cut back, then you hear people say they let me off, they let me go, because the hospital don't have no money, and Medicaid cutting fundings. So the hospital is suffering because the hospital can't do what they need to do, and we the patient are suffering. Vicky Briggins, my former co-worker, let them know 9B at North Central Bronx Hospital was one of the hardest floor to work. Nobody want to come here to work, you know. But Vicky, we held it down and we work like a family. And sometimes the patient them feel like we was the family. They feel like we had loved them so much that some of the man them used to call us their wife and they boo. You remember Vicky? Boo. You understand? It was the hardest floor to work. But when we come together and we put our hand together, nobody know who was the RN, who was the LPN, and who was the certified nursing attendant. Because we used to come and we come together, me, Vicky, and Pemberton, and all of us, and we share. We share the work. We share the work. But nurses today tell you, that's not my job. That's the nursing assistant job. Let me call the nursing assistant. You can't stop to help the nursing assistant change a sheet. And half of the time it's not time to give out medication yet. And you're sitting at the desk on your phone. Hey, boo, how you doing? Yeah, mom, just have a little time to catch up with you. What you doing? Where you there? Meanwhile, the nursing assistant a pass and her back a burst. Her back a tear open. You understand what I'm saying? You all are selfish people, some of you nurses. Because you all know you all go on the job and you all know half of the patient them sit down there and they can't say they get good care because of some of you. Some of you even don't want to touch vomit, don't want to touch blood, don't want to see blood. You all pass out when you all see blood. You all don't understand. It's experience that speak, not the certificate, not the license. I tell you already, I know how to cheat in college. Because me no going to do no accounting 1 and 2. And I come there just to study business. But they tell me that was included. I say I don't like accounting. They said it's included. I'm going to read everybody after. Because Cheryl, I see you posting some stuff. Post whatever you want to post. You're free. And you're supposed to have freedom of speech in this country. So whether you disagree with me not, or whatever you say, it's fine. Say what you have to say. But we need to understand that when you have experienced nurses, hold on to them, treat them right. Because we're looking for cheap labor, you know. But who's suffering? The patient. Some of the new nurses, them come in, they're scared. Because, you know, it's my first day on the job. It have to be your first job day. But it's nice to know that you have those skills. Professional, and when I call it professional, I mean with manners and respect. Okay? Who is going to teach them? Janice Martin, We are not in a position to knock people, but a doctor and a nurse can be a patient tomorrow. You could work in Ridgewood Savings Bank, and you is a CEO of Ridgewood Savings Bank, and you get sick tomorrow and you end up in a hospital, and the nurses don't know who you are, and they are so rude and disrespectful to you, you want to walk out. Sometimes you lay down in there and you will want your sheet change, and the nurses will come in there and they have their little free time, and instead of pull the sheet and tell the nursing assistant, come on, let's do this, let's do this, I got you. Work together, make everybody life easier. The nursing assistant then work hard. They're not out on strike today, they're in there working, and they're probably working with some nurses who is not skilled like the ones that are out there striking. But the patient's going to suffer. The care of the patient is going to suffer. We are suffering already with all the cutback and setbacks and layoff. And this strike, I am wondering, they say, oh, they're still going to do surgery. They're still going to do this. They're still going to do that. We understand. But there's going to be a delay in a whole lot of things. Betty, how you doing, Betty? Happy New Year to you too, Miss Palmer. Mistress Palmer, you never know, I don't get married easy. Okay? So let me tell you something. Take this protest seriously and don't talk foolishness to me. Because half of you don't understand. Me say, when I check out who is in charge of this thing called NYSA, I may be pronouncing it wrong, the New York State Nurses Association, pay attention. Find out who behind it. Because the goal, 2021, we're going to be suffering in silence. Because let me tell you something, with all the cutbacks that going on, it's only affecting us. But nurses, tell yourself, one day you too can be a patient. And when you go into the ER, them don't know you was a nurse. They don't know you was a doctor. And those same rude nurses might treat you in such a way that you will never understand because you was once a nurse. Nursing assistant, they work their behind off. And if I can fight for more money for nursing assistant, anytime they strike me walk out with them. Because they're not treated fairly most of the time. Just like some man, they will choose a nurse over a nursing assistant because of the title. But when they get the nurse now and the nurse rude and disrespectful and have no class, then they realize it's not about the title anymore. It's not about the title anymore. It's the woman. Let me tell you something. I want them come to an agreement, because anytime they come to an agreement, I am going through that hospital and I'm sitting down at the table again and I'm sitting down with them and tell them, anytime I experience any rude outbursts in Montefiore or Einstein, I am not pulling no nurse on the side like I did back in, I think it was August when I fell down. Janice Martin, you remember when I fell down in the street and had to be rushed to the hospital. And while I was doing the x-ray on my foot, when the two workers them finishing there, I couldn't feel the pain no more. I was in such a shock. They took away the pain. And it's after they treated me, I call on the supervisor because I let them know I sit here on the advisory board and I would like to speak to the two of them. And when they realized who I was, the apologies that I get couldn't help me. Because I didn't want nobody else to go through it. Yes, I reported it. Because it means it's something they've been doing and it will continue. Because sometimes supervisors not around in the night, nobody there to watch them. They behave how they want. They do what they want on this floor. Me not take no more abuse from nurses. It's all about the level of care. That's right, Miranda. I am not taking no more abuse. And when I say abuse, you go there sometime and you check in and they have you waiting so long to be seen. And sometimes when you go back there, you say, well, why was I out there waiting so long? The doctor said I was waiting for them to bring you in. Because them back there chat and the back there do what they're not supposed to do. And they got man problem. And if you don't watch it, don't go in there and try to talk to them too long because they don't want to hear your story. But let me tell you something. When I go to my doctor, I know maybe they want to say, Lord, I have to go. But they're going to listen. I am there for health care. One time doctors used to feel up with breasts, feel us up, feel to see if they feel anything, and all these kind of thing when we go get a physical. When you go in the first thing, how you feel? Well, not too bad, doc. I'm just here for my little follow-up. Okay, how is everything? You taking your medication? Yeah. Okay, all right. They want to hear your story. You tell them your story and they feel like you say you're okay. And the first thing they tell you, okay, we're going to follow up in the next 3 to 6 months. Everything is okay. All right, continue taking the medication. That was it. It was when they give you a phone video chat call. That's where we gone now, most of the appointments you want, you better take video chat. But you can't feel me up over a video chat. And you can't take care of me. You could listen to me. But I may need blood drawn. I may need you to see certain things. So I need to come in. We're fighting for better health care. Nurses are striking for more money. While they're striking for more money, somebody's being laid off. Okay, and they don't realize that, but you can't blame the nurses because if the union want to set them up, you could imagine you just come out of school 2 weeks ago and you just land a job and you just on the job and you're not even familiar with the job, but you got to go strike. You have to go strike because that's what they call for. And pour you out there strike and don't understand what's going on and don't even understand the nurses union. People, you have a right to fight for your money. But we as patients have a right to demand better health care. Courtney Wallace, greetings from Jamaica. Oh, you're showing off. You in Jamaica. It's nice to know you in Jamaica and you're doing okay after such a hurricane. Keep pushing, keep fighting. Just Jamaica strong and resilient. So, you're going to get through. But let me tell you something. Cheryl, you was a nurse for many years. Me know you because you're Ed Robinson girl, just like I'm Ed Robinson girl. But let me tell you something, Cheryl. One day, you or I could sit in that very bed as a patient where many patients are sitting today and crying out. And you know what you're hearing, as my friend said? The man striking, I'm just filling in. I don't know the hospital too well. I'm just one of the Philly nurses. I will be back. And they're gone out and you hear them. And imagine you as a patient where you're so accustomed to your nurse who understand you and know you. But because you're not there, they got to go through all over again. What's your name again? And the poor patient can't talk. And let me see what I can do. And you have to be your own advocate, Vicky. That's right. You have to be your own advocate. Claudette Brown, a happy new year to you, sweetheart. You have to be your own advocate. Nurses strike if you have to strike. Kimmy, good night to you, sweetheart. Blessing to you too, sis. Be your own advocate. Because we're going to suffer more than we think in this coming year. And it starts already. But you know why some of you not feeling it? You have a job that pay you good money. You have good health care. You don't have nothing to worry about. You're going to work every day. You do it any old how. And you have your big assurity income coming in weekly. So you're not worrying about nothing. And anybody come tell you anything, you light them up nicely. Jackie Herbert, I hear talking about the nursing strike, and I know some of them disagree and they may not like me, but I'm just speaking because I've been there. I've been there. And I've been a patient too. And I see what other patients go through. I remember I went in the hospital, they give me a private room. I said, I don't want a private room. I want to be in a room with somebody else. And do you know, the same night, I was going into the bathroom and I start bleeding so heavy. It was the patient that called them for me. I said, God, it was you all along. Look, the other patient could have called and say, my neighbor need help. And I couldn't do it for myself. Maxine Murray, blessed good night to you. I could not help. I couldn't reach the bell. But the patient in the room with me called the nurses them and they rush in and get me up. If I wasn't in a room with someone else and I was in a private room trying to act like I'm stoosh, I might have been in there suffering because they might have found me too late on the floor. Be careful how you want to live stoosh life and want special privilege. Be a patient and love the next patient next to you. Fight for each other even when you're sick. Because sometimes nurses are not doing it. I watch them, I listen to them, I talk to them, whether it's in Montefiore or Einstein or on the street or wherever, and I encourage them because I know what it is to be a patient. So people always strike, you're striking. Just understand that we, the patients, is going to strike too because we are going to demand better health care. And by doing that, it means we report you every step of the way. I used to be nice going into the hospital, and I'm not saying that because they're striking. I'm saying that for people to understand. When you demand you want more money in a time when there's a cutback, you need to ask yourself a question. Are we being set up? Are we being set up to help to destroy ourselves and our own and our community hospitals? We need to ask ourselves that question because we don't really understand. Because you can tell me the unions can't sit down and understand. Montefiore need to put it out there that they're in a deficit. All the cutback in Medicare is hurting the hospitals. So when they hurt the hospital got to lay off. And when they lay off, now the nurses, them get upset and they say, well, you know what? I am here and I am working short of staff. I'm working short of staff. They don't have enough nurses. We are not sitting down at the table and having good discussion. We are not sitting down and talking to the people that need to listen to us. So we don't understand what's really happening. We just hear strike and we happy. But one day, we are going to become the same patient. And you're going to have some of them nurses there who are going to put us through what we go through. And we're going to get up and say, you know, I was a nurse just like you. And I used to take care of patients just like you. But sometimes what goes around comes around. Don't let the money fool us. Take time with the raise and the raise and the raise. We want a raise too. We know them at the top is making big money too. And we're going to hear that. We're going to hear, you know how much them at the top are make? But you know, it's them at the top who making sure that you have your job and things are getting done so we could have a job. You know, without them at the top, we still that down here. Don't understand what's going on at the top. You know how many people working in Montefiore that I know, and they just in there to get funds, bring funds into the hospital and making sure the hospital are funded. You have dietitians who are there making sure patients are eat right and patients are surviving because they have a good diet. And you have nursing assistant. Nobody talking about housekeeping without clean environment, especially when we went through the pandemic, without housekeepers. Who people overlook and look upon them and say, oh, they're just a housekeeper. Give me a job in a housekeeping and I'll be the best housekeeper there is. I want the room to smell fresh. Sometimes they don't even clean the bed right. They just put on a sheet because a new patient is coming. Oh, they're tired of making a cleaning bed. They're tired of this. When you're tired, move on. Give somebody else a chance. And the work will be okay. If you're tired of being a housekeeper, if you're tired of taking out the garbage, I got to let the patient garbage pile up in the room, leave the job and give it to somebody else who is anxiously in need of a job and willing to take out the garbage. Don't stay on the job and make patient life miserable. Don't stay on the job and make the hospital have failures. I don't want that. So I'm telling you now, I am fighting for better health care. Just like you fight for wages, which you deserve. Don't get me wrong. But I think there comes a time when we are looking for things at the wrong time. They're out on strike now. And let me tell you something now that they're out on strike. You think patients are not feeling it? You think we are not feeling it? You are. We are. So when do we fight for better health care? By just getting the bad treatment and go home and cuss and say, me not go back to the doctor, me not go back to the clinic, them rude, they disrespectful. Stand up to them. Go to the top. Fight if you have to. But just don't walk out and say, you are not going back there. That is why the nonsense continue. So just like the strike, I am striking when this is over. Because I am sitting at the table and I am asking them, what is better health care? Respect the nurses, them who they are bending their back over for you. Respect the nurses who tell you I've been there for 24 years and they're doing it right. Respect those people because they are the leaders and should be the leaders on the floor. But some of them, they tell you, oh, me just see until retirement, me dear. You know how long me been here walking this floor, me dear? Me can't wait to retire, and they work like they're in retirement already. They drag, they pull, they don't want to hear nothing. They don't want to deal with nothing. They don't want to hear your story. They just say they come in and hear them. Kimi Dudun? Yes. I'm your nurse. They don't say the name yet, you know. I'm your nurse. I have to give you Tylenol. Okay, you take the Tylenol and they put the little water down there. They don't even know if you swallow it, but they're gone. They don't even know if you choke. I've seen it all, nurses. I've seen it all. And I'm not talking because of the strike. I've been fighting for you a long time. And I could say it boldly. Check Montefiore, Chuck Einstein, check Montefiore anywhere they are. I have been fighting for you, asking questions, demand. Let me go to emergency room right now. They're glad to see me because even when I sick and went there and in pain, me still concerned and asking the nurse, how is everything? How you feel? How is everything since the last time I see you? I take that back because I want to make sure the nurses, them are okay so that they could treat me right. But you guys don't understand what it calls patient care and what it calls for fighting for the rights of patient. They think it's the nurses, them alone could strike to say, we want better health care. How you want better health care when you're not giving us good health care when we come into the establishments? That is what we need to fight for, and I'm urging you all people, don't bother shut up no more. Don't walk out of the hospital and don't find complain. Fill out the forms when they send it to you to say, fill out the form. You know, the form after you leave, they tell you to fill it out to say how your care was and everything. Fill them out. Those are what help the hospital. You all don't take these things seriously. Well, you are sending me to go into some topics on this show because health care has to be priority in my show now, because I realize what's going on with us. Cut back. People in the islands, don't take this show tonight as is a New York show, you know. Because many of you leave the island, come here, come get health care, you know. So I want you guys, the survey, thank you so much, Kimmy. I want you guys to share this on your all island pages, because I know you Virgin Islands and St. Kitts, you all watching too. Share it, you know. And let them know that I say, you all leave the islands and come to America to get health care, you know. And when we who live here need health care, we are heard, we are hearing the long wait. So don't think you ain't gonna have the long wait. But you make your appointment from there and you fly up and you get the care and you run back down. But you better understand the same thing that affecting us is going to affect you. And remember, we live here, so we could run emergency room anytime. You fly, you come, you get your physical and you go back home. And obviously, you need to fight in your country for better health care too. Because see, if we got better health care in our country where we live, we ain't got to travel, go nowhere. But we spend so much time talking politics, but we are not talking about the right thing. But I am here to tell you tonight, This is just the start of the Avril show, because it's getting serious out here and it's getting nasty out here. So when we want to talk politics, we better vote, and we better make sure we have the right people in office to help us fight for the things that we are going through now. Because we take a lot of things lightly, but we shouldn't. Pay attention to what politics mean and what elected officials mean. We want people in office who is going to stand up with us, rally with us, and fight for us. That's what we're looking for. I'm not looking for people with title and position. I'm looking for real fighters. Just like Why Young. Why Young called my phone on FaceTime last night. So me I wonder, in the middle of the night, why Young calling me on FaceTime? Me no want to see no man at midnight. So me ask her, why you calling me on FaceTime? Janice Martin, I will be speaking, and I will be getting them on here too. We have to talk about the things. Because with the way cancer, diabetes, high blood pressure, and everything is taking us out, we better pay attention that we need to speak about these issues. And I tell you, me ask Why Young, why she called me last night on FaceTime. Why Young tell me, did you send me a message because the message didn't make sense? I sent her a message and the message get cut off because somebody called me and knocked me off, and I probably hit send. Why Young called me on FaceTime to make sure I sent her the message because she don't trust WhatsApp, and she thought it was a bogus one of them spammers trying to attack her WhatsApp page. So I am telling her, I text her and I say, it's me. She said, answer me 2 questions. Who is your 2 ex-husband on Facebook? So I said, Barney and Sangster. She said, oh, okay, it's you. That was something I made a note out of. And I'm going to speak about that at another time. Because Why Young, simple things like that put me head to race and give me ideas. I might be the little community show that I call this, but God bless me with a voice of reasoning and to come to the table with anybody who willing to listen to my conversation here. That I don't have time to talk politics. I have to talk about what is benefiting my people, my community, and helping us to strive. So people, in Jesus' name, I pray that the nurses get what they want. But I pray that when I sit with you, Montefiore, I could ask you now, what's in this for us on the outside? I know it was a verification call, and that's why I appreciate it, sweetheart. Let me tell you all something. Thank you, Kimmy. I'm going to continue to use this voice for me, my family, and my people, especially my supporters. If it's even 10 people listening to me, but that 10 people can hear what I have to say and it benefit them, I'm good. The other 90, they could get the information where else they're following all the winding up and skinning out and everything that they watch. They could do that. Because it comes a day where they're going to land themselves in a situation and they're going to be the one to say, call Miss Avril because she know the person at Ridgewood Savings Bank. Call Miss Avril because she know the politicians. Call Miss Avril because she have connection in the hospital. Call Miss Avril because I need a job. And when they get it, they don't remember to look at the Avril show because they get what they want. My people, I'm here to tell you, this is 2026. The no nonsense here. Because if you look what's happening with who is in office right now and what's going on around the world, we will pay attention that we need to watch shows that is bringing information that could put our mind to where it's supposed to be. Don't worry about how much followers you have, Kimmy. Don't worry about how much people like or comment on what you post. They are seeing you. You may not know who is watching, but they are watching. Some people don't want to watch your show when you're on because they feel you're going to see they're watching. So they'll watch it later when you're off. It's no problem to me. I still thank you for watching. All I'm saying to you, my people, our people don't like to push us. That's right. The 10 can share and 10 more will see it. Our people don't like to push each other because they look at you. Who she think she is? Oh, please. And they don't want to share. But when I see somebody think they share to me, that's when I know the mindset of my people. Sometimes you got to delete what some people send to you. I have a show. When was the last time somebody tell me you share my show? But you will share somebody else show to me to show me the nonsense that is fake out there. I was reading something and you know what it says to the bottom? It was done by AI, so it may not be 100% correct. But when I speak out of my mouth, you could say that I say it. We're living in a crab mentality, Kimmy. Even our very own family sometimes, you may do a show. And if you ask your family what you spoke about, they don't know. They don't support you. Sometimes your own, who you think is going to be there for you, they don't support you because they think they will make you big, especially if you rise up in a position or in life and they thought you would have been a nobody. They don't want to make you big. Don't think it's your enemies alone you got to watch. Crab in a barrel. They round you, they hug you when the people that they talk about you to is not watching. They're busy hugging you. And when they're around the people they talk about you with, they act like they don't see you. Then they go home and they call you on the phone because you look like you're striving and you're doing something. I know them well. And that is why I know my supporters. I know my followers and I know my talkers. So I don't get caught up into how much people is on my page. It'd be good if you have 200 friends, because guess what? You could keep a track on that. But imagine you have 5,000 friends and you make birthday and it's only 150 people comment. Those are your 150, you might as well. The rest of them is just there to make numbers, watch you silently, watch what you're doing, and they're not there to encourage you. Okay? So bear it in mind, people. Get off of how many friends you have, how many follows you have, and how many people like your picture when you put it up. Trust me, they see it. They see it. Don't get fooled about it. Listen to me, my people. This show is sponsored in part. The people that make sure I'm on here is Best Deal Car Service. And when I need a cab, they're number one because I know they're giving back. They're making a difference in the community and they're always supporting things that is happening with the Avril Show. And they're making sure that the community gets what they need. McCaw's Bronxwood Funeral Home, I could call on them anytime to help someone in the community. And they're there to support me to help what I'm doing. Teddy Volkswagen of the Bronx, I thank you for standing with me in everything that I do. I couldn't have done it without you. I have to pay for all that I do here. It's not a free Facebook Live show that I do. I just come through Facebook, okay? Everybody know I start radio since 2002, and I've been doing radio and Facebook at the same time before the pandemic. Attorney Hugh Campbell at Rodman and Campbell, thank you for being the strength and the support to guide me to do the right thing with your expertise. Ridgewood Savings Bank, they may not be a monthly sponsor here for me, but let me tell you something. They support the Avril Show Cancer Foundation year after year because they know what I'm doing. And for anyone out there who feel that when I do something, it benefit me, all it do is stress me because putting an event together, it's not easy and it's not cheap. And guess what? cost me sleepless nights, even just to sell the tickets. If they hear $120, you know, many people come out and pay $120, and when they leave, they say, my God, I can't wait for next time. Because they ain't just pay $120 and come and sit down and hear a load of long speeches. Sometimes that's how you network. Sometimes that's how you meet people. Sometimes that's how you hear people's story and know what's going on. But many of you look at it like, me not eating $120 worth of food. But when you all need help and somebody's sick for you and have cancer or going through what they're going through, you all call Miss Avril because you need some support. But you all don't remember that if it wasn't for the people that come out and support my cause and help me to raise the money, I couldn't afford, along with Ridgewood Bank, in December when they had a luncheon for cancer, the cancer survivors. And we was able to go and present $1,500 in December so they could have a luncheon. It came from the money we raised. And we do many more with it. We're not getting paid. This is our giving back to our community when me and Angela and Jill and Miranda and Phipps and everybody who come together, and Chico who come and play every year for us, and all these people that help the Avril Show Foundation to be successful. People don't understand. It's giving, they're giving back by being a part of this foundation so we could get fundings to do and help the community. This show is not done for free. So many people talk to me and tell me how great of a show I'm doing, how great of a job I'm doing, and I could never tell you they help me unless it's something free. So the free things I stopped doing, let the elected officials them do it. Ridgewood Savings Bank was giving away toys. Let them do it. They're a business. I am not going to go around and keep doing free. And when it's time for me to get some money to help me with the foundation to do what I need to do, I don't see the people. Can they tell you, oh, you don't have the money? But watch them. Every day they depend Timu and Himu. I order this, order that. Me can't tell you how to spend your money. You see this hairstyle? The hair alone is $5 a pack. I bought 3 packs and do my hair. Y'all think I'm going to take my money and throw away? We're going to talk this year about money and finances. Because you're going to do you go fund me to bury all your loved one, but don't call me. Do not call me. Because this is a new year and the nonsense stop. So people, may God continue to bless each and every one of you. Good night to you, Camille Edwards. Good night to you. And to all the nurses out there that I spoke about, I'm only sharing with you that one day we too can be patients. And I know many nurses out here, if they listen to me tonight, they will tell me, Avril, I too became a patient. And tell me about your care that you had. Because see, when I walk in the hospital, I don't go in there and say, oh, I'm Avril Francis. Oh, I'm from the Avril Show. Or I sit on the advisory board at Montefiore. I don't do that. I like to catch them. So I go in there with my mask on and they do whatever they have to do for me. And later you hear them, wait, you're saying Avril. What you didn't tell me was you. I don't have to tell you who I am. The same care you give me is the care you should give everybody. Ain't no special care when it comes to me. But treat me right. Treat me as a patient. So I will continue to fight for you, my people. But nursing assistant, home health aides, the people that do the cleaning, I pray that God will open many more doors for you as you climb. If you're a cleaner, be the best cleaner there is. And if you're a nursing assistant, say it with pride. Because you hold up the nurses. It takes all of us to work together. And until we understand that, we will never look down on another. May God continue to bless us all as we continue the journey of 2026, where all we are faced with is cut back and sit back. Don't take it as a joke. Cut back and sit back. Ladies and gentlemen, these are the people who helped me make it. You hear me face the family say talk the things them who it hot. Yeah, they not gonna like me. They not even like me when me not talk. So when me talk tonight, where you not think more gonna hate me? So it doesn't matter. As long as I'm speaking truth and from experience, I'm gonna speak it. Because you see, I tell you guys, pay attention. You're a nurse today. You can be a patient tomorrow. Do good, so good will follow you. And if it don't follow you, it will follow your children, your grandparents, your mother. Just remember, we all in this together. May God continue to bless us all and keep us safe in this flu season. Keep jobs on our table, because with jobs, you keep food on your table. So keep jobs on your table, a roof over your head. And may your children continue to understand what it takes to be living in 2026 and what rent was in 1992. They don't know. Teach them. Truth to power, my friend Janet Dixon. Sorry, I'm just seeing you late when I'm getting ready to say goodnight. My people, it was a pleasure being here with you, and continue to listening to the #1 show, the hottest show, the biggest show in America, the Avril Show. Who tell me say that? That's right. If you're not going to big me up, I'm going to big up myself. Anyway, God bless you. Walk good. Pray before you go to bed. Anoint your house. Go around your rooms. Pray. And touch your children door. And touch your room. And ask God to walk through your house. Ask God to cover your household. Your children. When they're going in and coming out. They're coming out or they're going in. Pray for your children, them. No matter how bad they be, that's when you pray for them. Because prayer that held many of us here today. Prayer that holding us together. Somebody pray for you. Continue to pray for your children. And remember, as Yolanda Freeland say, continue to show off in 2026. God, grace and mercy kept you. He kept me, and he kept many others. Show off in Jesus' name. Never look down on a man unless you're picking him up. Good night, everybody.